We are right at 1 minute until we begin. We'll begin promptly at 8:30. Good morning, everyone. Welcome to this week's community sector briefing. As always, we will start with Laura McDougall with an update from Four Corners Health Department. Laura?
Good morning, everyone. We are going to go ahead and also give everyone an opportunity within all the sectors to give an update. So if you have an update for the COVID-19 briefing for York County this morning, please, I will just have you unmute and give a short briefing for your sector. To begin though, we'll start with the public health briefing. I actually on my drive downtown, I received a text that we have another positive in Seward County. So we're up to a total of 19 positive COVID-19 cases in the Four Corners district. 8 of those are in York, 5 are in Polk. Now we have 5 in Seward total and 1 in Butler. We've also had 1 death in Seward County, and that happened this recently. It happened and was reported on Monday. We have 8 people who have recovered in the district from COVID-19 and are back to their usual activities, and we expect that that number will go up today. That was actually a number from a couple of days ago. So we're checking on that again today. So hopefully that goes up. We have 100 people in quarantine across the district, and they're being monitored. So without the event that we had yesterday, the total number of people that have been tested have been 307. And we have, without the event yesterday, we have 8 people at least who are still pending their test results. And so I'd like to talk a little bit about the event that we had yesterday. We had an expanded testing event out at the Holtis Convention Center, where working together with all the medical providers and our different partners, we had pre-identified people who either had some kind of a risk factor or they had symptoms, different groups that we were looking to test that maybe a test hadn't been available for them previously. We had 97 people scheduled to test yesterday with the Nebraska National Guard. And between everything that happened, we actually ended up testing 89 people. Some people had a last minute cancellation or they didn't show up. So we tested 89 people. We thought that was really good. It was a very smooth event yesterday. We ended up seeing that, I believe the National Guard said that they had 49 people go through in the first hour and be tested. It was a smooth operation and well organized. And we're very grateful to the Nebraska National Guard for coming and making those tests available to us. We expect that it'll take at least 1 to 2 days, possibly even 3, but we should hopefully know by the end of the week here how those test results are coming out, how many positives and negatives, and be working on notifying people and taking appropriate action. So in the state of Nebraska, just to give you an update, this week, as of the Nebraska dashboard this morning, there are 1,813 positive cases, 45 deaths. and leading the way on the county's testing positive is Hall County. They have 588 cases. So we're really watching that statistic carefully and what's going on in that county as well. You probably have noticed from the media that we are really having a lot of the positives come out of some of the meat packing plants. So we do have meat packing plants around our district. We don't really have one in our district, but we do have people who work in meat packing plants living in our district. And so we're going to be really, trying to assist if there's testing needed around that. And I know right now we're looking, there's the Smithfield plant in Crete. There's a plant in Madison, and then as well as some of the plants to our west that we'll just continue to really monitor. And if there's employees that need to be tested, we'll try to assist how we can. So with that, I believe that's Madonna, that is my report this morning. And of course, if you have any questions, please feel free to type them in the chat or unmute yourself. At the end, we'll have time for questions.
Thank you, Laura. As she said, we do have a team member here monitoring the chat, so feel free to type in a question. We will begin at this time if there is anyone from York County that would like to give any kind of county-wide update. Okay. We will also go ahead and put that out to our various villages and communities. Henderson, McCool, Bradshaw, Benedict, Waco, Gresham, anyone?
Good morning, everyone. This is Barry Redfern from New York. Just a couple comments I'd make. The city basically is staying course with everything we've been doing. One thing I would like to add this morning, which has been something I've gotten quite a few calls on, is that Aaron Dressel has worked with the landfill people to get the landfill open to the public. And so I think that was in the paper this morning that Tuesday through Friday it will be open 9 to 2 to the public and Saturday from 9 to 12 to the public. So that is something that has been closed to the public here for the last month. So I know there's some people that have been anxious to be able to take some things out there. With that, the only other thing I would add is I know everybody's getting anxious about a lot of things, and we've talked about the outdoor pool and things, and are waiting till we get to the first of the month, and we'll see if we get any clearer information and be able to make some decisions on all that. And it's as it continues to be a fluid situation, we just kind of have to wait and see how all that will go. So that's all I have this morning. Thank you.
Thank you, Barry. Do we have anyone from Henderson, McCool, that would like to have a report? Okay. We'll go ahead and move to the medical sector at this time. This is certainly open to York General, Henderson Healthcare, Urgent Care, Mahoney Health, any of those professionals in the medical sector.
Madonna, I can start for York General. So Jim Ulrich. York General is planning to begin performing elective surgeries for our general surgeons, visiting specialists that currently are seeing patients and or have continued to see some patients in the specialty clinic, or those that are willing to resume visits to York General Specialty Clinic. We would look to kick those off according to the guidelines from the governor on May 4th. As you know, some of the things we have to look at is we have to make sure we have a 2-week supply of personal protective equipment. Need to make sure that our we have 30% of our ventilators available, and make sure that our inpatient census has 30% vacancy. And today we meet all of those, and but we will continue to monitor that as we go. We'd also be looking at some diagnostic procedures that become necessary when you're prepping somebody for surgeries and some things, quite honestly, that are backlogged that we need to get done is in the way of diagnostics before they do become major issues for individuals. We've done some looking back at canceled cases and everything. So we've developed a plan on how we're going to try to stage this in. And I know area facilities are doing likewise the same thing that York General is. We kind of assess that. We're certainly a close-knit neighborhood as far as colleagues of CEOs of hospitals and trying to all stay on the same page with what's going on. I think a lot of our discussion is centered on the fact of what is a new norm going to be. And it's hard for us today to visualize when things do step back, even in cases that we're not going to continue to have probably a more heightened use of personal protective equipment and more screening of patients that come in the door, maybe some realistic looks at what visitors and the amount of visitors that will be needed in our facility in the future. I think that's going to become more of a normal look at, it's going to be more of a new norm. And, none of us know for sure what that's going to be, but certainly there's a feel that's building that way, is that we need to operate in a world that's probably of a heightened sense of just precautionary. And now I know this is a very fluid situation because I see one of the chat questions that's out there is, when's the peak going to be in Nebraska? I think the governor's thought that it was going to be in that first early May timeframe. And so I'm sure that's why he looked at, loosening the directed health measures on elective surgeries around that first part of May. But obviously all this is a fluid situation. If some of the testing, happens around us or here in York that turns out a lot more positives, or if some of the surge of patients comes more of York's way, a lot of what we're talking about could change. Laura, you had mentioned about the cases around us. York General, we track that every single day as well. And it's hard not to see that the meat packing plants seem to be more of those building hotspots in Saline County, Madison County, as well as Dawson County and Hall County. So we're keeping our eyes on that as well. And certainly appreciate all the continued communication of Four Corners and helping to organize with all the providers in the area, the testing that was done. We want more testing done so we know what's really out there. And we can begin to do all the quarantining that Four Corners is helping to orchestrate and do, so that we know where our peak is and where our cases truly are, and get our arms around it. So I appreciate all those efforts. Our PPE situation is getting better between all of our campuses. We've actually had some back orders that were placed a long time ago with some of our regular vendors that have started to come in at the Hearthstone yesterday. It was like Christmas for them, getting the gloves that they needed and the mask that they needed, that I think our administrator at our Hearthstone, Jay Colburn, had said that they probably got a month's worth now. And that's huge for them. And because of all the touch they have with the residents constantly, on all the heightened awareness toward keeping COVID-19 out on that, of our long-term care sector too. So I think I'll cut my comments off there. Thanks for the opportunity to report.
Thank you, Jim. Are there any other medical facilities that have a report? Okay. I will go ahead and go into the business sector report before we go into the educators and faith-based and nonprofit. We do want to highlight that the business response survey put out by the state of Nebraska will close tomorrow. This survey was put together by economic developers as well as chamber and our state government to help formulate a plan to reopen. And so they need to have as many businesses in the state put their thoughts in this survey. So please go out to yorkdevco.com to find that survey. If you were unable to have your SBA loan processed in the last round. We encourage everyone to stay connected with your local lender regarding the newest phase that is currently in front of the House today. We hope to see some movement on that shortly. In addition, the deadline for the CDBG grant of the City of York is next week. If your business is located in the City of York or within the 2-mile jurisdiction, has employees other than the owner, you may be eligible to apply. Please contact Southeast Nebraska Development District or York County Development or the Chamber office, and we'll be happy to connect you. We do know that there is an uptick of unemployment in York County. But on the other side of that, there have been quite a few job postings that have been submitted to both the Chamber and YCDC. So please take the time to visit those websites for these employment opportunities. And finally, I want to put this out there that there is a program going on right now that is ACE Community Cares. Blake Burgess has put out a challenge to help support our local food bank, and the Chamber is assisting with the collection of these funds. If you want to support the Blue Valley Food Bank, you can donate to the Chamber using our Venmo handle at YorkNEChamber, or you can go online to yorkchamber.org/online payment, or you may just contact the Chamber office. And we'll go ahead and move to the education sector, open that up to Mitch Bartholomew or Brian Best, any of the superintendents, York College or Southeast Community College.
Good morning, this is Mitch Bartholomew from York. Just really a quick update on a couple of things. YPS continues with its e-learning plan at this point in time, and so teachers are working hard, providing the best lessons they can via Zoom, mostly some Google Classroom. They're also, just with the nice weather, they're also trying to incorporate, getting outside and getting some fresh air, those type of things. And so really proud of our teachers at this point. We're trying to make some summer plans the best that we can when it comes to some of our groups that have to get together. But at this point in time, we have postponed anything and everything. And we're just, kind of waiting just like everybody else for the next couple of weeks to see what we're going to be able to do. Graduation, just a reminder, our high school principal, Jason Heights, is working with our senior officers and several other seniors, and they would really like to have a ceremony if possible. That is their number one choice. And so they've identified a couple alternative dates. One is June 27th and the other one is July 25th. I will say that we've been advised, the governor spoke about this about a week ago too, that for schools not to expect to have any type of a graduation, especially in June. We haven't eliminated that, but we're really not anticipating being able to use that June date. And so our attention has probably switched to the July date a little bit more, but we'll wait and see. The last thing is there has been some conversation about not being able to start school in the fall. And just want you to know that there was an article published about a week ago, and it had some inaccurate statements in it, just so we're all aware of that. The Commissioner of Education has told school superintendents just to be in the back of their minds, be thinking of what would be an alternative plan in the event of, but has not said anything. It's way too early to make that decision. So he has not said that schools will not start in the fall, just to make sure we have a backup plan if that were to happen. Thank you.
Thank you, Mitch. There is nothing to report from York College, correct? And then anything from Henderson or McCool, Nebraska Lutheran in Waco, Southeast Community College? Seeing none, we will go ahead and ask if there are any nonprofit organizations or faith-based community that have anything to report.
Morning, this is Erin from York County Health Coalition. We have launched last week our COVID-19 response fund. We've had several applications come in as well as donations, so thank you for those who donated. We have dispersed about half of those donations already, mostly toward rent, food, and electric bills or other utility bills. We also sent out information to many of the businesses in the area, especially our fast food areas who still have hourly workers, to hang in their break rooms for their staff. If you did not receive a flyer and you would like information either on our community response program or COVID-19 response fund, please get in contact with me and I can send you information to share with your staff. One thing that we have been hearing a lot of is the need for financial literacy and financial stability moving forward. So we do want to share there are some resources out there online. Financial Peace University is offering a 2-week free trial online that goes through all of their information on budgeting, debt payment, saving for emergencies, those types of things. Is a 2-week free trial. They do get informed when their trial is about to be up so they can cancel before they have to pay. The same company is also offering Smart Dollar for employers to offer to their employees to help employees learn about debt repayment, budgeting, saving for emergencies as well. There is a cost to that, but you do have to contact Smart Dollar to get that information. Nebraska Children, in collaboration with several other entities in the state of Nebraska, has just launched the Child Care Referral Network. It is an online website where individuals can go and you type in your city and or your zip code and you will get a list of licensed childcare providers in your area. I believe so far we've got 9 of our York area licensed childcare providers on there. So if you are looking for childcare or you've got employees who are looking for childcare, the website is nechildcarereferral.org. We are hoping to get more licensed childcare providers on there. So if you are part of a childcare facility or you know others who are that are licensed, please direct them to that website to get their information on there. We're also having conversations both about homelessness and mental health. So we have been working with local providers and other organizations to understand better how we can support that. So hopefully we'll have some more information in the coming week or weeks. And then lastly, please complete your census if you haven't already. That is a really important thing as dollars can get dispersed for different types of benefits and help for our county in the future. So if you or your employees have not yet completed your census, please do that. You can do it online. And I know that they, if you call in or even online, they have it in several different languages to complete that. I think that's all I have for right now.
Thank you, Erin. I know there are some questions on the chat. I'm going to go ahead and get that, and Laura will probably come up and answer those. The first question, Laura, 911 had shared that the PSAPs yesterday on our weekly meeting, their local health department is testing subject of sore throats as well as new symptoms of COVID. Have you heard anything about that? Just confirmation.
Okay, so to answer that, yes, we now our testing is opened up enough that we really are looking at testing if people have some of the more mild symptoms, and sore throat is one of those, that they might be able to be tested potentially, especially if they're in one of the high-risk groups. So contact your medical provider and check into that if, especially if you're like a healthcare worker, we might be looking at testing you for if you have a sore throat or some of the other mild symptoms like headache, low grade fever, cough, that, you know, we are looking at potentially testing, expanding that testing. And let's see, what else do we have here? Okay. Jim, this is for Jim. Media reports have talked about the vulnerabilities of rural hospitals. Would York General treat COVID patients or forward them to a larger facility?
This seems like a flashback to our last get together, wasn't it? I think I had a meeting like that or a question like that before. A lot of factors go into that. Let me talk first about what we have in our organization that would enable us to, if need be, to treat a COVID patient. We have 3 isolation rooms at this point, and we also are able to very quickly convert one of our entire hallways to being negative pressure, which would be isolation as well. And we have, on top of that, we have 3 ventilator units. So could we treat COVID patients? Yes, we could. We have the PPE and the know-how to do it, but there's a lot of factors at play. If there's a severely ill patient needing an ICU and things like that, we are going to look to transfer, I'm sure, you know, to an available ICU unit, whether it be Bryan Health or where that would be. As far as patients that would come from Hall County, I know was mentioned last time. We've seen those patients go to another CHI facility. It's been in primarily St. E's at this point. And I think at last report, I think they were using 14 of 18 maybe of their ventilators or something like that they had available. And from what I hear in St. Francis as of yesterday in Grand Island, they don't really have many at all non-COVID patients. They're pretty much COVID patients. So I think the thought would be maybe Grand Island or other communities affected may send non-COVID patients to the smaller hospitals. But what we're seeing is, at least for the CHI hospital in Grand Island, they're sending more of that to St. E's, you know, as far as their COVID patients, and maybe even considering Omaha at this point. But Craig, to your question, though, we could treat COVID patients, but there's just a lot of, you know, if there's a better setting as far as an ICU for them to be in and it's open, we're probably going to end up transferring them there. But we have had patients that have been suspected COVID patients that are in our facility, and all facilities around us see that as well, you know, while the testing's being done. So they're in an isolation room at this point, and it's a reality, and it's something that we can deal with. I know the reports for more vulnerability of rural hospitals, some of the facts they had on there weren't correct. I think that if you're thinking of the same one I had, they were talking about critical access hospitals having 30 beds and things like that. That's not even correct to begin with. So there's some inaccuracies that come along with that, but there's some critical access hospitals that aren't as well equipped as what we are on that end also. But typically critical access hospitals do not have intensive care units, and that is one of the differing factors and a reason that if a patient gets to a certain level, we're going to be looking to transfer them. Hopefully that answers your question.
Thanks, Jim. And I'd like to add too to Jim's comment that there are in fact other, it is being tracked across the state how many beds are open at all the hospitals and how many ventilators are as a whole system. So that's becoming tracked and more visible to all of us as to what's available out there. And Jim, if you have anything to add to that.
Well, Laura, that is something I put out to our staff for communication every day too. I track the same website, the DHHS website, and it does change daily from what I've been able to tell. And I think as of yesterday, there were like 48, somewhere in the 40% of ICUs available, beds available, vents available. So things on that end, as far as resources for the state of Nebraska, are at a good point right now. And that's why we really keep track of where the peak will be, and just what our keeping tabs on resources is a huge part of that analysis and communication overall.
Thank you, Jim. So we have another question. Could more detail be provided regarding contact tracing? And so this is really where Four Corners is working, our lane that we're working in right now. And this is where, just to give you an update on the Four Corners staff, we brought on additional nurses and staff to help us do contact tracing. And this is something I know that everyone's hearing a lot about in even the national media. How do we increase our contact tracing? So when we talk about contact tracing, what is it? Four Corners, so we receive all the lab test results across our district for anybody who resides here. When a lab test is done, we are notified of that result. So when we see positives come in, we will contact that person as well as their medical provider and start an investigation. And when we do the investigation, we identify everyone that they may have been in contact with during the time that they are infectious. So we get our calendars out, we look at all the days. When the symptoms first appeared, we go backwards a couple days, and we will track everywhere they've been. And then we look at how what kind of interactions they had with everyone and how much at risk other people might be to being exposed to the virus. If we feel that people have an adequate degree of exposure and they've been exposed to a certain extent, we will place them in quarantine. Usually, if we know that maybe someone you were outside and you walked by someone in a park, probably would not constitute exposure unless you were coughed upon by the sick person. So we track every step they make, and then we work in those circles and quarantine people. We ask the people we're quarantining as well if they've become sick, if they have any symptoms whatsoever, and we may ask them to go get tested, or we may create another quarantine circle around that person. So when we contact trace, it often involves larger groups of people. Thankfully, when people are doing a good job social distancing and not doing a lot of traveling, staying home, these circles of quarantine and the tracing of contacts, it doesn't take us nearly as long, and there's not nearly as many people placed in quarantine. So that is the advantage for public health when people are staying home and limiting those people that they're having close contact with. So I hope that explains the question there, just to kind of explain though what we're doing in public health right now, and it does really take quite a team to do that.
We have a Facebook question about hand sanitizer. It says, has the state trickled down any excess York ethanol supply to Four Corners for local business use as needed after all the hospitals and clinics in the state have an adequate supply?
So at this point, what we know is we have been receiving, as part of our shipments of personal protective equipment that we've been distributing through Four Corners, we have received some large containers of hand sanitizer that are being distributed to those different first responders, hospitals, clinics, different groups that have placed orders with us. Now, as for the supply of hand sanitizer out in the community, I am not sure. I do not know the answer to that question.
We were generally received some.
Yeah.
But that's all.
Okay, we do know that some of the partners that have that ability to place orders from us are receiving those things. So I'm not sure exactly what the commercial supply, what it looks like right now. If I go to Walmart this weekend, I might be able to give you a better answer on that.
Hey, I was able to buy toilet paper last
I know,
week.
we were able to buy toilet paper, which is a huge accomplishment, so. Okay,
Yeah, are there any other questions?
Are there any other questions, or anybody else feel like they would like to give a report?
Laura, this is Margaret Brink.
Hi, Margaret.
And for those of you who may not know me, I am president of the local Board of Health. And I've become the sleuth. I'm sort of like Jane Marple. And I've been kind of going places and watching. And so we watched the testing site from across the open field so I could see kind of how that was working. And that was pretty interesting to see. But as we watched going through the Walmart parking lot, I'm a little distressed. We saw people going in with no masks and with children, and I saw one person go into Walmart with a mask on, and I saw one person coming out with a mask on, and everybody else is just going in and shopping. And I thought that Walmarts were going to be tighter across the nation with their coming and going of customers. So I have a concern for that. My other concern is that when we go do our habit of Starbucks, they are in masks, and I appreciate the baristas who pass out the coffee with their hats on. I mean, their masks on. But you go to Wendy's, and the kids passing the food out have no masks and no rubber gloves. So, Laura, is there something that we could ask the, I don't know about the other fast foods. I just know that I was a little alarmed at that. And I don't mean to be nosy with everybody, but I think those of us in the community, we want to model the good behavior, but we also want to kind of turn in the people that maybe are getting too lax in where they're going and how many people they're taking in the stores, and they're not going protected. So do you have a response to that?
Yeah, I would ask everyone on this call to just help everyone in the community. Gentle reminders to, as they go out, and you know, we find that if people choose to wear a mask and do things voluntarily, we have a much better result in getting compliance in that. We do recommend that people wear masks when they're out in public, and it's primarily to protect other people, which is, you know, a gesture of great, you know, community response on that individual's report to wear, on that individual's behalf, to wear a mask. So we encourage people as they are working in the community, as they are going to the store, to wear a mask, because it does help protect others in the community. We also, you know, we also would advise that people don't take their entire families to go shopping if they can avoid it. Just that one trip a week with just go alone is really what we're advising at this point. We don't know, you know, we know that there is community spread going on, so in everyone's best interest for their safety, just limiting that exposure in the community is best. So, you know, I would ask everybody, help us reinforce that idea to put your mask on when you go out in the community.
Laura, this is Erin with the York County Health Coalition. One of the issues that is causing that is that we do have single parent households who do not have an extra adult to keep children at home. So there will be families that are going out shopping. I don't know what the exact answer for that is, but that is one of the reasons we are seeing families out.
I agree, Erin, and that was running through my mind too, as very much that is the case, that some people have no other option than to take their children with them. So I guess be aware of that as well. Thank you, Erin.
Is there anyone else that had anything they wanted to share? Yes, Cindy. Perfect.
I would just ask if is there availability of masks for people to purchase or have when they go out? I mean, that could be the other issue, that people are not wearing them if they don't have one or have access to getting one. Is there availability we can make in the community for people to get one?
So I would ask that if anyone does have availability of masks to perhaps put that out there and share it. I'm guessing that the chamber would be willing to put that out if there are masks available. If somebody wants, you know, if people are sewing masks. The other thing is that it is fairly easy to make handmade masks just out of what you have at home, scraps of material and things. And so there are a lot of videos and things on just how to take an old t-shirt and make a mask. Or, you know, you can use a bandana and make a mask. And it requires rubber bands, hair ties, and just a square of material. So if you have a scissors and some clothes you want to get rid of, you can probably make a mask at home. And Cindy, you're smiling. I think you were trying to prompt me into giving that information out again. But I know that that's posted in many places, and we can have that posted on the chamber website as well, how to make a homemade mask. So thanks for that question.
Any other questions as we start winding down? Just I'm checking my chat monitors here. Nothing. Okay, well, as we close, as always, we just always want to say thank you to Laura and her team for the phenomenal job that they are doing, keeping all of their whole region notified and informed. And we want everyone to just continue to interact with their neighbors and everyone with kindness. Looks like I have a last minute. And this Zoom video will be released on York County Development's website once it's all compacted and prepared. And then I also want to echo some things that Aaron Sam said. You know, let's not be judgmental when we do see people going shopping with kids. So we just don't know everyone's situations, and just be respectful and maybe just say a little prayer that, you know, they might need a little help. So thank you all so much. And we are running out of battery.
People are leaving.